Recently on City News, we've been sharing stories from patients in desperate need of surgeries, though because of a provincial mandate, they're being declined the medical care they desperately need. Tonight, the calls are growing louder as more Ontarians share their stories.
Apparently, having an open chest wound that could become infected is not considered an important surgery.
Sabrina Worrall received quadruple bypass surgery last January after the mother of two suffered a heart attack. She thought she was through the most trying time of her life. Little did she know, her medical journey was just beginning.
In February, the incision popped open because the sutures dissolved before it healed. So it was big enough that I could actually fit a pop can in my chest, which is not something I ever wanted to do personally.
On January 4th, the Ontario government directed hospitals to postpone all non-emergent procedures to open up hospital capacity for the surge of COVID patients.
Cancer surgeries have gone delayed. We have colonoscopies and mammograms for screening of cancers that have gone delayed. What we know, though, is that 20 million healthcare services have gone delayed. It's now taking up to 30 months for a hip or knee replacement, for example.
People's lives are on the line.
Opposition at Queen's Park today chastised the Ford government for their plans to reopen indoor capacity at bars and restaurants next week, while many hospitals are currently over capacity.
Not a single word about a plan for dealing with the backlog surgeries to give people a sense of when they might actually have their health needs addressed.
The provincial government has said the non-urgent surgery directive to hospitals may be in place through mid-February, but has offered no other timeline.
Even my nurses can't believe that this wasn't done months ago.
Worrall has metal wires from her bypass surgery sticking out of her chest. Her surgery appointments to have the wires clipped have been canceled by multiple hospitals.
Every time I move, I can feel them pulling at my skin, and it'll start to close, and then because they're sticking out, it'll just rip the skin. It's right in the middle of my chest. If I get an infection there, it could easily go to my lungs or my heart.
My sister was diagnosed with kidney cancer.
Last week on City News, we introduced you to Mike, whose last name we're withholding to protect his sister's privacy. Following our story, his sister received a call that her cancer surgery had been rescheduled for this morning. Unfortunately, today, it was postponed once again.
When you're waiting in the hospital bed to get the surgery today and then you get the news that it's canceled, it's deflating.
Last week, Ontario's Minister of Health said that COVID-19 related ICU admissions are expected to continue to rise. And until that number, as well as the number of overall cases, comes down, the mandate will remain in place. I'm Adrian Gobriel for City News.